Vishram, we were chatting on phone and this meeting with Anandji was fixed.
Ma'am,
So it was
ma'am, we are live
very
now.
yeah.
We are live.
Yeah. Namaste. This is Dr. Archana Dwivedi, Midlife Management Committee Chairperson under leadership of our vibrant President Dr. Sunita Tandulwadkar Madam. I wish you all a happy Janmashtami today and also wish Madam to clear with us 200 episodes of Gyan Pravah today. So a round of applause for Madam because her vision to have it 8 p.m. every day without fail, she's with all the committee chairpersons or whatever subject we are talking. And this Gyan Pravah is flowing flawless from January to this date. And being the 200th episode, it brings me a special honor today, Madam. Thank you for making us a part with this. This is a very unique concept, Dr. Anandji, where
Indeed.
Madam has given an open forum to all the committee chairpersons. We are 13 number, and 31st is Madam's Day, where we run through the spiritual, and there are so many other aspects of her, and keeps us blessing all the time. Just to
Good.
add a little feather in her cap, she is accomplished clinician, obstetrician, infertility expert, laparoscopy, and we also want to declare the happiness of completing 100 Eagle projects, training the laparoscopic surgeons pan-India. Madam, it's a wow effect, a marathon task. And Madam, with my co-friend, Dr. Sejal Nayak, they have done tremendous work and gives me a little honor, the collars up valley feeling today when I share this with you. And as a Foxian, Madam has given us a logo, the theme of the year, Ek Rashtra, Ek Mission, Swasth Nari, Samruddha Vatan. Her Ghar Foxian. And believe me, she has reached out to each one of us and the Foxians, having the Anubandh program where we meet with all the zonal representatives, talking to them, taking care of their problems, and leading them through and through whenever the difficulties are there. Not only this far, there are multiple projects. I think these two projects will make you more interested. Know your numbers, where the common woman should know her numbers. Numbers means her BP, her sugar, her weight, and her hemoglobin. That is very important when I have to prevent patient going from Anandji later on. So that is a marathon task. But Madam is dead its way. I mean, know your numbers has reached to heights. I mean, just 6 months and we are already going great over that. And the second project, the Sampurna project. Sampurna project is Madam doesn't want, her vision says, be pregnant when you're really ready for it. So developing a lady in mind, physical, body, and spiritual aspect, supplementing her, nurturing her well before she actually decides to become pregnant, so that she is a better mother and a better parturient, and also her post-operative or post-delivery period that we proudly call as fourth trimester doesn't head to a misery. It's always a pleasure to be a mother, pre, during, and post. So it gives me little goosebumps right now talking to you with Madam that it's almost just 6 months and this 200 episode completely blessed. And I would like to hear some words of wisdom from Sunita ma'am, and then we'll proceed.
Thank you. Thank you, Archana. We are so fortunate that we have reached 200th episode. Dr. Anandji, welcome on a Foxy
Thank you.
platform. It's an honor to have you. And believe me,
Mutual.
the 30 committee chairperson each day, for example, today is the 16th. So every month on 16th is Archana with one of the faculties, stalwarts, academic, non-academic, spiritual, political. She's in Baroda. So Baroda की रानी से लेके गायकवाड़ family से लेके उसने सब ले लिए हैं. Given their life, how they do the work, their philanthropic work, everything. And I felt that these chairpersons are our future leaders of our organization. So let me give everyone the platform in the evening where everyone listens to them with the very important faculty. It will develop their confidence, their oratory skill, their creativity, their thinking, whom we should interview, what we should put in. And that's
Right.
how the leadership grows. But believe me,
Absolutely.
Anandji, more
Yes.
than this, I joined 200 days just to make faculty feel that the Foxy welcomes you. We are honored to have you. President coming and giving you the salute or the wish or the welcome always gives a little extra touch, I felt. So every day, 8 o'clock, I make it a point to join unless I'm on the air because I travel a lot.
Yeah.
More than my chairperson, I am so happy. I'm meeting the personalities
Mhm.
pan India, pan globally. And it has given me such a beautiful exposure of a life. How much people are doing in various fields, it's eye opener. We had even Nitin Gadkari ji on our chat board on this podcast. So it's really, and I believe that 365 podcast probably will have a very valuable knowledge grantha with us, and we'll think over what we can do compilation of them all together. There are many more projects. Foxy is a very vibrant organization, 75 years. I'm a 63rd president. My past presidents have worked so well that today we are very much established, well known, with 46,000 gynecologists, very well structured. Internationally, FIGO also respects us, and Foxy became a very important part. I must give a credit to all my past presidents for that. And my
Yeah.
committee members, they have no choice because I work hard, they work doubly hard. So my eagle project is every aspiring gynecologist learn endoscopy, where in medical colleges pan India we go one day, we carry all the machineries and we show simpler surgeries of hysterectomies, myomectomies, hysteroscopy. We make them wash with us. In one day no one can teach, but we give them where to look after passing your MD, because endoscopy today, there are people, gynecologists in their fifth and sixth generation decade of practice. They probably are not expert endoscopists. They miss the bus. But the upcoming gynecologists have no choice than to learn endoscopy. So we just like to give them a vision. I know once they pass out, they will fly, they will join the fellowship. It is not just the observer post, anyone can work and learn. It is doing the fellowship, assisting, seeing many difficult cases, understanding and accepting one's limitation over the subject, and then entering over it so that we make a safe gynecological surgery for future.
Great.
So, and that has completed in 6 months, 100 medical colleges and 200 projects here. Our Sampurna, we are sensitizing the gynecologist to say that every pregnancy should be a planned pregnancy. You sensitize the community over there, wherever you are working. And we are reaching out to 286 societies. My 200 faculty are going every weekend in different directions and doing the program. I'm thankful to all of them. I got blessed with the one of the best team. Every president must be feeling so, but mine is truly one of the best team anyone can choose on. So thank you, Archana. Thank you for having Ananji, and I'm sure it will be one of the best podcasts. Lot of learning. It may stimulate many more youngsters, and I wish both of you a very enjoyable dialogue with each other. Thank you, Anandji, and
Thank
welcome
you.
on Foxy platform.
Thank you, Sunita.
Thank you.
I think she's very humble.
I
Her
know.
smile and her hard work just keeps us going. She says it should be done, it just happens automatically inside us. So, thank you, ma'am, for the words of wisdom and presenting a good friend. And I think Dr. Anand Ji Khakkar is a transplant and hepatopancreatic biliary surgeon. We were,
Oh, my husband is GI surgeon,
that
Dr.
is what,
Rajesh.
what I thought.
Oh my
And
gosh.
in
I just
2000, he was with Raila in London to learn
Uh-huh.
the transplant. But that time it was in initial phases. And
Yeah.
then by the time it came, he has such a busy practice. He does ERCPs and everything and a laparoscopic surgery that then in 1 year he took out his name from the transplant team. Ruby Hall transplant was on his name, the license and everything.
What is his name?
Dr. Rajesh Tandulwadkar.
Okay, great. No, the Ruby Hall's liver transplant program was started by us, by me and my team from Apollo Chennai. I was a director of Apollo Chennai
Oh,
during
you were
those
in
times.
Apollo.
So me and my one colleague, Manish Verma, who was designated to handle this, but I
Yes.
have been there. We did the first 100 liver transplants for Ruby Hall, and I must have been there for at least 90 out of those 100 liver transplants.
So before your team joined, sir,
Yeah.
probably Dr. Kamlesh Bokil and Dr. Rajesh.
Yes,
Were.
Kamlesh Bokil is still a very good friend. He was there with like most of the transplants that we did. He used to give us a hand, and I was a very, very ardent learner. He's a very, very personal, very good friend. I know he
Very
drives
good.
a
Lovely to
blue
know that.
BMW. Yeah.
So I
The world
head
is
the
very
Ruby
small.
Hall OBGY and Ruby
Yeah.
Hall IVF department for last 30 years, sir.
I
Ruby
see.
Hall IVF endoscopy. Endoscopy is all I develop.
Uh-huh.
And my hospital is very kind, Dr. Grant, to give me
Hmm.
two 3D systems. Now we have robotic. Now the new upgraded robotic is coming. We are
Uh-huh.
very well equipped at Ruby
Uh-huh.
Hall with all the things. What you have seen before and what
Yes,
we all today in 5 years, where it has gone is unbelievable and unimaginable.
I know. I
So
know. I mean, it's very inspiring. The place actually has good infrastructure and very nice team as well.
Yeah.
I forget the name of the CEO who was there with us
Bomi
those days. He
boat.
must be the same. Yeah, Bomi
Bomi
Bot.
boat.
Yeah, he facilitated, and it was a very, very nice time at Ruby Hall. So no, I mean, I'm just speaking in between out of my turn, I guess. But your
That's okay.
your your approach has been very overwhelmingly inspiring. You know what? The time has come that in the decades to come from now, medicine would be more holistic than we currently practice. And you are absolutely right that what we deal with is physical systems. We are in modern medicine, it is like a bottom up approach. But what you are additionally incorporating is like a top to bottom approach. So it is complementing what we do with our hands is bottom up, while what you do with your spiritual inspiration and mechanisms is top down. So it definitely elevates the level of treatment being offered and helps in alleviating the problems of the patients in a more holistic fashion. Nature and cosmos works via mechanisms, and we in modern medicine work via mechanism. But the point where the mechanism transits into intention is consciousness, and consciousness is what spirituality boils down to. When I asked you what I meant to ask was by
I
by
never knew,
approaching
sir,
it.
how much you know about consciousness and
No, I
spirituality.
know.
So
Yeah.
I never knew. So I thought
No,
ki this
no, that's
will be
fine.
very high words for me to talk to
No,
you.
no, no,
But I'm
no.
so glad. So on
Yeah.
31st of every month, we take
Yeah.
Gita and we
Mm.
discuss Gita on 31st of every month. So
Sure.
my
it was such a
responsibility to share.
fantastic thing
Yeah.
to know about.
Yeah.
I think more and more we grow, we become mature, we understand we are just the tiny human being here,
Hmm. Very
and
true.
there is
Yeah.
huge power. We have to come out from I, and everything will be fine.
Yeah. Yeah.
Okay,
It is.
madam, let me take that introduction a little further, please, because it's an honor to introduce Dr. Anandji, who is also a BC Roy awardee in 2015, Presidential National Award, the highest civilian award for medical professionals in India. More than 1,500 transplants in India is under his belt, including more than that what he was doing abroad in US and Canada, but 700 and above living
Mhm.
donors in India. That is to his credit. And I think you have got a special interest in transplant that we were talking about, sir,
Mhm.
because he started with urology, madam, I was just talking about, but his passion to transplant, along with doing the urology, he did pursue that. And his personal qualification is never ending, but clinical instructor, liver transplant and hepatobiliary surgeon, Columbia University Medical Center, New York. As Ruby Hall now is your own, I think the world is very small. I don't need to say that. But
Yeah.
ASTS Fellowship, Liver and Kidney Transplant, University of Western Ontario, Canada. ASTS Senior Fellowship, Living Donor, Liver Transplant, Pancreas, and Multivisceral Transplantation and Hepatobiliary Surgery. University of Pittsburgh, TE Stiles Transplantation Institute. DNB Apollo Hospital, Chennai. And he's from our own MP Shah Medical College, Jamnagar. And it's my
Yeah.
proud privilege
We
to.
are coming, sir, this year in Jamnagar. So, with our spiritual Arogya Yog
Sure.
Yatra to Dwarka, it will be
Mm.
wonderful to meet you physically sometimes.
I studied in Jamnagar, but I'm currently located in Ahmedabad at Zydus Hospitals. So
I
from
am coming Ahmedabad on 6th of September. Definitely.
so then that would be a
I'll
early
arrange
occasion to
that,
meet you.
madam, that we have a cup
Yes,
of coffee together. That's my
That's
surely.
wonderful. And
Yes,
our perform the pattern is you both will be in the frame, and I'll be listening to you from the viewers link.
sure.
So see you sometimes.
Thank you.
Definitely.
Thank you,
Thank
ma'am,
you.
for
Surely.
your presence.
Thank
Thank you
Thank
so
you.
much.
Thank you.
So, Anandji, taking the word forward,
Sure.
where did you develop this passion for transplant? What the idea came in your mind that you choose this branch?
I will, it's a bit of a story. I hope you don't mind my wasting the viewers' time. But during preparing for my MS General Surgery exams, there was we use this textbook called Main God's Abdominal Operations, and chapter 13 was orthotopic liver transplant. And my seniors told me skip it. कोई नहीं पूछता क्योंकि liver transplant इंडिया में होता नहीं है. So I skipped it. And then immediately after the theory exam, I came to know, I had read a week before the practical exam that India's first liver transplant was done at Apollo Chennai by somebody called Dr. Veena Girinath. And I just looked at the name of our external examiner, and the name was Veena Girinath. And I panicked. I thought, oh my God, this lady who's done India's first liver transplant, although the transplant didn't work out, but she did it, and nevertheless. And she's going to be my examiner, and I don't know anything about the novelty that she's introduced. So I sat down to read. The subject was fascinating. And Dr. Veena Girinath is a very inspiring person. On the day of the exam, as it is in a tradition in Jamnagar, at the end of the day, we spent the rest of the evening with the external examiner, who's always a renowned stalwart in the field. And so, spending that later half of the practical exam day with her, I decided, yes, this is what we're going to do, no matter how hard it is to train. And soon after passing MS General Surgery, there were no places in India to train. To be able to train in US or Canada, you need USMLEs and a lot of, there's a whole process to getting into them, their training programs. But what was immediately available, and while I prepared for this, I took urology and I finished the DNB urology curriculum at Apollo Chennai. And during that, during the 3 years of residency, I finished my licensing exams as well as secured my admission into a training program. And as soon as I finished my urology, within a few months, I was in Canada pursuing these. So it was the like I fell in love with urology just listening about it or just looking at the picture. I had never seen a liver transplant before I landed up for a training program. So after I finished the American board certification in liver and kidney transplant, I went on to do a senior fellowship at the University of Pittsburgh. That is the Mecca for liver transplant. That is where it was born. Tom Starzl is the father of liver transplant, and I had the fortune of training with him for living donor liver transplants, pancreas transplants, and multivessel transplants. So then I served as a faculty, like you pointed out, at Columbia University before coming back. And I came back to Chennai because in those days, Gujarat didn't have infrastructure that would be able to launch these kind of ambitious programs. So I was in Chennai at Apollo, Chennai from 2007 to 2020. But I'm basically from Rajkot, from Gujarat, and so after having spent like 2/3 of my life outside, I thought I should come back home. So just 3-4 years ago, I relocated back, and I am with Zydus Hospital now for the last 3 years. We just finished 250 liver transplants at Zydus over the last 3 years, including we did Gujarat's first simultaneous liver kidney transplants, about 7 of them. We started doing ABO incompatible liver transplants for even acute liver failures. We've done pediatric transplants, we've done HIV positive transplants. All these were among the firsts in the state, and I'm glad it has picked up all over. There's a buzz, there's an energy, and it's picking up. I'm very happy to be here. Thank you.
Thank you, Dr. Anand, for that beautiful introduction, because I feel just 15th August gone back and patriotic feeling. So being an Indian, serving the Indian population at their doorsteps for the liver failures and so many other ailments, I think this is the best service to the nation we can provide. So
I want
coming
to add one thing here. I want to add one line here.
back,
This is what when I was planning to come back to India from New York, there used to be a lot of Indians in the community who told me that, wow, आप इंडिया वापस जा रहे हो, वहां तो बहुत जरूरत है आप जैसे लोगों की, आपकी बड़ी आवकार होगी, people will welcome you, you will have a great time there. And I was a little skeptical, but nevertheless, when I came back, it confirmed that India does not need anybody. India is a very wholesome place. It has a capacity to fulfill its own aspirations and ambitions. And whoever, wherever in the world wants to come back to India, should come back to India because he wants to come back to India or she wants to come back to India. Not because India needs anybody. India does not need anybody. India has everything it needs. You come to India because you want to be in India. Why am I here? Because I am happy here. I feel at home here. Not because I'm here to, salvage anybody. I'm here for my own salvation.
perfect, perfect. So, Dr. Anand, when we were studying during there was a statement that like said, female, fat, 40 and fertile is
Mm,
going to suffer from something related to cholelithiasis, liver
mm,
disease, or
mm.
pancreatic disease. So, I think that stands true because books have mentioned and our experience says. But how does a liver function change as woman ages, especially after 40? Why I say 40? Because of my midlife passion out here. So would like to listen from you.
Yeah. So, see, fat in the liver
Mm.
is something that we have started picking up because there is an improvement in the technology related to ultrasonology, as well as there is an increased sensitization among our radiologists, as well as the clinical fraternity about the liver becoming fatty. And also because prosperity that has come to India secondary to our economic liberalization has changed our lifestyle in a few bad ways. We now can afford to live a little more sedentary lifestyle. More of us have become couch potatoes. We eat a lot of junk food. We love cheese, and we can afford to eat all kinds of unhealthy foods without actually working them out and sweating them out. And unfortunately, also there's an increase in the rate at which youngsters as well as adults consume alcohol. So all these have increased the incidence of liver disease, and I want to say that liver disease of any form presents as a fatty liver to start with.
Mm.
Whether you have hepatitis B related liver disease, hepatitis C related liver disease, whether you have alcoholism related liver disease, whether it is autoimmune hepatitis, Wilson's disease, or just a fatty liver. What that means is non-alcoholic fatty liver disease. What you want to call as a fatty liver means the absence of all these etiologies. And you still have fat in the liver. That fat in the liver is proportional to your body mass index.
So what are the
So
yeah,
yeah.
please. Yeah.
So basically when you are in midlife, a lot of things happen in relation to the hormonal milieu, the way the hormonal milieu changes as a woman approaches the menopausal age, as well as there is a certain socio-economic background to this as well. Increasing women in our society, unfortunately, play too many roles. They wear too many hats, and we grossly undervalue and underappreciate the role of women. The woman, today's the woman is not just a homemaker, but she is still as much a homemaker as well. And she is still a professional. She is still ambitious, but she's still a mother. She's still a homemaker. She has all the social responsibilities, none of which have been taken over or transferred to the males. And therefore they really get no time to spend for themselves. They don't get dedicated time to go to the gym or exercise. They don't have the privilege to decide the menu as per their health related aspirations or otherwise. So while doing everything, they continue to suffer uh, because of the vials of the society. Because children like to eat something, they would have that as what they have to cook. They have to make sure that the children go to school, the in-laws are taken care of, the husband is taken care of, and therefore there's no time left for her to take care of herself. And the stresses that are added to the lifestyle because of these increased responsibilities, as well as the career related goals and ambitions that that our women of today are endowed with. So as a result of all that, what you end up is a stressed out woman who tries her best to reach all the responsibilities that she's been saddled with, and with very little time to take care of herself in terms of physical fitness, or no liberty to take care of her diet, along with changing hormonal milieu. I don't know where to put the largest blame on, but all these factors play a role.
So once I see a fatty liver in the ultrasound scan, and just because you are here, I would like to know what are the warning signs when I make my patient more aware that our liver is calling you. So
Mm.
warning signs and when to intervene. And I will add one more thing, that health checkups regularly we are getting this fatty liver changes in the scans. So little bit confused, apprehensive, what to guide. So how do we go about it?
So there cannot be a more pertinent question than the one you raised right now. And I'm glad you raised it, because I think this would be the gist of my today's interaction with you. So the most important thing when you see a fatty liver is to know whether there is an associated hepatitis, which means to say that it is bad enough to have fat in the liver, but it is worse if there is inflammation associated with that fat. And that hepatitis essentially is never innocuous. So, as it is, when you have a fatty liver disease, as I just said, it does not mean you have only a fatty liver. You need to ensure that you don't have hepatitis B, you don't have hepatitis C, you don't have autoimmune hepatitis. You need to make sure that your HbA1c is normal and that you're not a diabetic or a pre-diabetic. You need to make sure that your lipid profile is okay. So these are the most basic investigations that one needs to do whenever you come across a fatty liver on ultrasound. I mean, there are other etiologies, Wilson's disease, hemochromatosis, alpha-1 antitrypsin, but we have to pursue all the ghosts until we know that there is associated hepatitis and that we might need to treat the etiology specifically. But these ones that I just narrated, hepatitis B, C, autoimmune markers, as in just simple or anti-nuclear antibody, NCA, as well as the LKMA and AMA. So these four antibodies need to be ruled out, and you need to make sure that your HbA1c is within acceptable numbers and your lipid profile is okay. And then you can safely assume that this is non-alcoholic fatty liver disease. I mean, of course, you have to verify that the individual is not consuming alcohol. And after these, when you say non-alcoholic fatty liver disease, then you embark upon the necessary alterations in the body mass index, alteration in the lifestyle, as in a certain amount of exercising on a daily basis. The general recommendation is up to 2 hours, like 1 hour of brisk walk and 1 hour of isometric limb and girdle exercises, which either you can do it at home versus you could go to a gym, and that will be more definite. Definitive way of getting it done regularly, and introducing a fair amount of green leafy vegetables in your diet, as well as becoming cognizant about the various components of diet that you consume, like the amount of fat, the amount of carbohydrates, and the proportion of proteins that are a part of your daily diet. So if you see somebody who's grossly deranged in this balance, then you might help them by referring them to an appropriate dietitian as well. But this is the general approach. Now, I just mentioned that you do a liver function test and make sure that there is no elevation in the SGOT, SGPT, and GGT. But if there is, then you need all the more reason to identify the etiology until you get an etiology. And this might include going all the way up to doing a liver biopsy, if essential, to identify the potential etiology that is perpetuating an inflammation or hepatitis in the liver. Because hepatitis of whatever the etiology will progress to cirrhosis. Please understand that cirrhosis is not a disease. It is a result of healing from damage to the liver. This nobody understands, even though it is so obvious. It is like somebody had pimples on their face. It was a biological injury to your skin. But how did that, after the pimple ruptured, how did it heal? It healed with fibrosis. Even though you have endless amount of mesenchymal partially differentiated stem cells in the basement membrane of every organ, including skin, including liver, including every other organ. But whenever there is an injury, nature does not respond by healing that using the mesenchymal stem cells. It heals only with fibrosis. Whether it is damage to the liver, whether it is damage to the kidney, whether it is damage to the heart, whether it is damage to the lungs, this is the basic physiology of the human body that any mesodermal organ, when injured by whatever etiology, be it a physical injury, be it a chemical injury, be it a biochemical injury, be it a biological injury, whatever be the mechanism of injury, it heals with fibrosis, and gradually increasing deposition of fibrosis leads to replacement of the space where parenchymal cells are supposed to be housed. So liver is an encapsulated organ. There is only so much space. भगवान ने उसको लक्ष्मण रेखा में बांध लिया है. It does not have unlimited space to be occupied in the abdomen, and it is within the confines of that capsule that liver cells have to house themselves and function. And that space is being gradually replaced by fibrosis because of perpetuating injury. Whether that injury is because of a biological agent like hepatitis B or C, or a biochemical process like diabetes, hypercholesterolemia, metabolic syndrome, or a pure chemical process like say Wilson's disease, copper deposition, there is hemochromatosis, iron deposition, or whatever be the mechanism. So, in order to identify the etiology and then treat the etiology, so that you can stop the hepatitis and stop the gradual destruction of the parenchyma and replacement by fibrosis, is the aim of treating these patients. So it is extremely important that all the practitioners who come across these patients need to understand this mechanism and approach it appropriately. So, I mean, there is a huge role that you guys are playing, in educating the medical fraternity, because oftentimes I come across our own fraternity who have not understood this phenomenon in adequate clarity, so that they are able to intervene. And like you rightly said, hepatitis B is 4 to 8% in India. Gujarat is 4.5%. 2.5% of our country has hepatitis C. 3% of the dry state of Gujarat is alcoholic. I'm not talking about once in a blue moon occasional drinkers like even you and me might. I'm talking about people who seriously consume alcohol on a regular basis. There is 3% of Gujarat. The rest of India is much more. So, hepatitis B, C, and alcohol is 10% of the population. Add the metabolic syndrome, another 5. So 15% of the population. And now we have not even started talking about rare causes like even autoimmune hepatitis or PBC or PSC, or we are not talking about those, just the normal routine 5 top causes. There is 15% of the population. So every practitioner, no matter whether you are a family doctor or you are a physician, you are a gynecologist, you are a neurologist, you are a cardiologist, or whatever be your specialty, you will come across patients who have a positive etiology that can perpetuate and cause chronic liver disease or cirrhosis. So identify them by spotting a fatty liver first. And you are absolutely right that the only real way of preventing or reducing the morbidity and mortality of liver cirrhosis is to pick it up early, is to prevent it. And the reason I say this is because liver is a very resilient organ. It is like your horse, कि जो कभी थकता नहीं, जो कभी बैठता नहीं, और एक बार बैठ गया ना तो कभी उठता नहीं. तो उसको बैठने से रोकना है. एक बार बैठ गया उसके बाद कुछ नहीं कर सकते. Once you cross 70% of parenchymal replacement by fibrosis, it will decompensate. Until then, it is compensating because it needs only 30% of the total functional mass that you have. So until you destroy 70%, it is not like that, teenage girl who whines and cries at little things. It is not like that sensitive princess. It is like the robust, that robust सेनापति जो कभी बोलेगा नहीं, साला मरते दम तक नहीं बोलेगा, लेकिन जिस दिन वो मर जाएगा तब कुछ नहीं करेगा, कुछ नहीं कर सकता. So it will directly decompensate. The first time you see a liver disease present itself clinically is when it decompensates, when it crosses 70%. And then it is not repairable, then it is only transplantable. So the only way to prevent it is with preventive health checks. Know it before it comes. Once it is there and it knocks on your door, game is over.
I think you very beautifully pointed out that health checkups are important gifts to yourself, especially above 35 of age, because to detect is to prevent, as Dr.
Yeah.
Anand very rightly said. But in our clinical practice, Dr. Anand, people do land up, especially ladies, with so many advertisements going on, herbal bottles, herbal supplements. That even if you prescribe them, go sometimes. How? I mean, I would like you to clarify these herbal supplements. Are they real tonics to the liver?
Liver is the is the seat of homeostasis in your body.
Mm.
It brings back what is normal in your physiology. Its job is to restitute everybody else. It does not need, it does not need to be pampered. It does not need to be given a Gyan Pravah, or it does not need to be given anything. It will heal itself as long as you don't kick it every day. You don't need any herbal, there is no herbal supplement available to mankind and verified and validated that has the ability to detoxify liver. You know, if you have hepatitis from whatever etiology, and if your liver is being damaged and replaced by healed by fibrosis, you need to stop that etiology. You need to stop hepatitis B. You need to cure hepatitis C. You need to stop alcoholism. You need to control diabetes. You need to control your autoimmunity. But beyond that, whatever has fibrosed is not reversible with any known herbal medicine. Because if you can reverse fibrosis, then you can reverse lung fibrosis also. Then you can reverse cardiomyopathy also. Then you can reverse arteriosclerosis also, and you can prevent atherosclerosis also, and you can increase longevity of humankind if you can treat fibrosis. The problem is only in preventing damage that leads to fibrosis. There is never a mechanism by which you can undo any of this, and there is no mechanism by which you can improve the vitality so that it can beat the hepatitis B virus. Hepatitis B virus can be beaten only with antivirals. Diabetes can be beaten only with anti-diabetic medications and preventing or curing diabetes. There is no tonic that will protect the liver from the damage of diabetes, or from the damage of viral hepatitis, or from the damage of autoimmune hepatitis. So whoever else is trying to give you a liver detox, please know him as the guy who is misguiding you, reading you the wrong way, giving you a false sense of security. There is nothing worse than a false sense of security. Just as, when you go to the airport, you see, you see the CISF guy being, easy, letting you go. Tell him, boss, you are my enemy. You're letting me go. You're going to let some terrorist go in. Check me. Prevent a terrorist from going. So same way, somebody who is spreading false information is a very harmful person. Please know that as the enemy of the society. Ban them, shun them, actively voice against them.
So I think the protector doesn't need protection, but if it's
Yeah.
protection, that means that the time has come. You should rely only on the probable sources which will enrich the liver more, rather than falling prey to the other medications available
Correct.
easily, cheap, but maybe not good in a longer use. Thank you, Dr. Anand, for that insight.
One more thing I want to say here is that, stem cells.
Yeah.
A lot of people that have been, talks every now and then, every 3 months, I get 2-3 patients who say, no, वहाँ पे ना एक डॉक्टर है जो स्टेम सेल थेरापी करता है. मैं बोला, मेरे भाई, अगर स्टेम सेल थेरापी सक्सेसफुल होती, अगर वो काम करता, तो ये ऑल इंडिया इंस्टीट्यूट नहीं करती, ये मेयो क्लिनिक नहीं करता, ये अपोलो हॉस्पिटल नहीं करता, ये जायडस हॉस्पिटल नहीं करता. क्यों सम गली में एक ब्रिलियंट आदमी बैठा है जिसके पास वो नॉलेज है जो किसी के पास नहीं है, उसके पास सक्सेसफुल होता है स्टेम सेल थेरापी, और कहीं भी फेल नहीं होता. Stem cell is like a child who is totipotent, is capable of becoming anything and everything. तो आपको उसको पायलट बनाना, तो आप क्या करोगे? तो उसको जाके एयरफोर्स पे स्टेशन पे, या तो एयरपोर्ट पे जाके यू ड्रॉप हिम देयर एंड ही विल बिकम अ पायलट, इज इट? No, he has to become, he has to go to a primary school, then to a high school, then to a college, become an engineer, then a flight school, and then he becomes a pilot. He doesn't become a pilot by dropping him at the airport. So similarly, a stem cell, when you put it inside the liver, it does not become a hepatocyte. I mean, you guys of all the people know that ontogeny repeats phylogeny. An embryo becomes a monocellular organism, and then a multicellular organism, and then it repeats the entire evolutionary cycle, starting from an amphibian to a vertebrate to a mammal to a Homo sapien. You cannot make a unicellular organism directly into a Homo sapien cell. It doesn't work that way. Nature does not have a mechanism for that.
Perfectly said. Dr. Anand, vaccination, how does it help in preventing probably hepatitis or the liver damage?
So the millennials, are vaccinated at birth. So, the Indian government has introduced vaccination at birth for hepatitis B, and that has gone a long way in reducing the incidence of this disease in the like in the millennials. But you and me were not given this vaccine. And similarly, there is no vaccine for hepatitis C, but hepatitis A, which we all, have generally, it's a fecal-oral route transmitted hepatitis, which all of us suffer from at an early age, and it provides lifelong immunity. But for those who don't have antibodies to hepatitis A, these vaccines are available both injectable and oral form. So a part of the preventive health check should be to identify your hepatitis B surface antigen status, as well as know whether you have antibodies to hepatitis B, either because you were exposed to that virus at some point in time, even though you naturally eliminated it. So once you are aware of your status for hepatitis B surface antigen as well as antibodies, you need to take appropriate measures to vaccinate yourself if you don't have adequate protective levels of antibodies. And this is true for hepatitis B only. Hepatitis A, again, yes, but nothing for hepatitis C or E, or there are several others which are less important in terms of the incidence and prevalence of the disease. Yes.
Yeah. And do you think that women are more having incidence of autoimmune liver diseases?
I mean, I am not aware of any demographic study which has unequivocally stated this, although from time to time you do come across reports which say that because women harbor, another life in their bodies, and there is a certain amount of exchange of fetal blood during particularly the time of parturition. And this is also the time when vertical transmission of hepatitis B can happen from the mother to the child, and therefore it is very important for expectant mothers to be screened for hepatitis B surface antigen, and if they are positive, we need to take precautions at the time of childbirth that the newborn is not infected. You need to give them immunoglobulins. But yes, so that is the process by which another human DNA gets introduced into the maternal blood and thereby sensitizes them to onto antibodies. But other than that, autoimmune hepatitis, PBC, primary biliary cirrhosis, has a slightly higher propensity for occurrence into women. But other than that, the sclerosing cholangitis or the other forms of autoimmune hepatitis perpetuated by anti-nuclear antibody or antimicrosomal antibody or LKMA induced are not known to have a higher incidence in women.
So I think we are having a very good take-home message right now that ultrasound screening, taking care of the liver by certain blood tests, and not relying on the sources easily available. Go to
Yeah,
the proper channel is the
yeah.
best thing you can do about your liver and other things.
Not the WhatsApp doctor or the YouTube doctor. No, no, no.
Yeah. So I think there are medications for so many comorbid conditions which above 40, definitely it has a lifestyle thing going on. Indians are becoming aware, but there are people who are living with comorbid conditions. So long-term medications, as you said, liver is our senapati. So does senapati fall prey to this long-term medications also?
Yes. For example, anti-tuberculous therapy has a known hepatotoxicity profile, and particularly the rifampicin as well as the INH have a significant propensity for liver damage. There are some anti-malignancy drugs, particularly methotrexate, which leads to liver fibrosis. Other than that, not many other medications except any heavy metal. Basically, liver is a center for detoxification. So if you are consuming heavy metals from whatever source, be it dietary or be it some form of herbal medications, then they'll end up in the liver as a part of its detoxification requirement, and the liver is capable of macrophaging these heavy metal molecules, but it gets overwhelmed at times depending on the dosage and the frequency with which they are consumed. So they can be harmful. So drug-induced hepatitis is known from heavy metals, from methotrexate, from anti-tuberculous medications. But other than that, no, except if somebody has an idiosyncratic tendency. Generally, no other form. In the West, yes, you see a lot of acute liver failure because of paracetamol poisoning. Now, that's an acute liver failure cause, and mainly seen in the Western population. In India, you almost never see this. One other drug-induced liver failure is seen following rat poison consuming. These are the phosphine-based rat poisons, which are consumed as a tool of committing suicide, particularly in southern India, Kerala in particular. So yes, these are the drug-induced forms of liver disease that lead to either acute or more commonly chronic liver damage.
So being a woman, Dr. Anand, I'm also very conscious about my weight. So if somebody says do a crash dieting and you get your figure back, I think everybody's tempted to go on that. So this rapid weight loss, this crash dieting, how does liver respond to that?
So, when you do crash dieting of whatever sort, it's called the keto diet. Obviously, it means you are going through a ketogenic process. And this ketogenic process leads to acute fatty liver, which sometimes you see during pregnancy as well. So acute fatty liver is a result of very stringent and arduous dietary regimes. So I mean, if the physiologic way of losing weight without incurring an additional damage to the liver would be to lose approximately 1 maximum 2 kilos a month. If you try to lose faster than that, then that is when you induce a ketogenic process which the liver has difficulty handling. Ultimately all metabolic acids have to be detoxified by the liver, even though they will eventually be removed from the system by the kidneys. They have to be detoxified by the liver. So acute or crash dieting leads to lactic acidosis, accumulation of metabolic acids, which are seen in the form of base excess in arterial blood gas analysis. And these are a cause of acute fatty liver, which I have seen in very significant or certain few cases, leading to even acute liver failure.
Yeah, so I think we should be very cautionate about that.
Yeah.
And coming to the latest developments, the future research and all, does something excite you? Some newer development, AI technology, anything which is like more hopeful for you in terms of liver care, like precision in medicine or non-invasive methods,
See,
imaging other.
see, AI is a loaded word. Like I don't know whether most of us understand the AI is a more elaborate computer. It can handle more algorithms. It can correlate more things. It can help. I mean, it's like a super smart person, somebody like you who can process more information than say somebody like me. But again, it is not divine. It is not magical. Whether AI will bring us, the only thing I can think of what AI can do to us is something that your president, madam, may be more excited about. It will ultimately. We have tried to create artificial livers in the lab, and we don't know how to convert stem cells into hepatocytes or mesenchymal partially differentiated stem cells also into hepatocytes, or make them into biliary epithelial cells, or liver vascularization. And even when you have the scaffold, even when you decellularize a diseased liver and you use that scaffold and infuse mesenchymal stem cells with growth factors that are capable of inducing further differentiation, you don't get an artificial liver. We have not learned the art and science of inducing differentiation. So I don't see an artificial liver or an organoid coming up anytime in the next 20, 30 years. We have the Human Genome Project with us for the last 30 years. We have not learned how to read those codons. We don't know where which gene is encoded, which will stop the differentiation of a vertebrate hepatocytes and start the induction of a human hepatocyte. Okay, so we are very far from converting stem cells into anything significant. On the other hand, like what Madam was saying, is that when I am sad, I get throat disease. When you are sad, you get stomach pain. That is because your and my Prakriti is oriented in a slightly different fashion to respond to various stresses, be it uh, diet related, be it lifestyle related, be it systemic stresses, biological stresses. And therefore, you have a different propensity to harbor certain diseases in different organ systems versus me. So being able to analyze individual prakrutis, being able to put it into a certain algorithm of thought will tell you what kind of predisposition is more likely to land you up with a liver disease, or land me up with a heart disease, or land somebody else up with a kidney or lung disease. So having those informations aligned with a certain risk profile in terms of lifestyle, viral profile will eventually help us identify a section of patients who are more likely to fall prey to, say, liver disease, or fall prey to, say, heart disease or lung disease or kidney disease or gynecological disorders even, so that is eventually going to help us tell people more specifically on what they should do in order to live a healthier life. Yeah, if I know that I'm more likely to develop lung disease, then I'll be specifically careful about what I do with my lungs, versus if I tell you you are more likely to fall prey to kidney disease, then you will make sure that you stay alert and aware about what all you do to your kidneys, the diseases that are known to inflict these organ systems. So a more holistic approach, if I may use the right words, a more incorporation of, see, please understand that modern medicine is a disease management protocol. We do not understand prevention. For us, prevention is early detection, and early detection means it has happened. There is no prevention in modern medicine except vaccination. The prevention comes from life sciences. We are disease management protocols. So the life sciences are the Ayurveda. This is like life science. This Veda is the science of Ayurveda is life. Homeopathy, which understands the the local milieu of our hormonal orchestra. It's not just the hypothalamus and the pituitary and the thyroid and the adrenals, but it is the paracrine and the local icosanoids, which inflict its mechanisms on of the disorder onto the organ system. So a better incorporation of all these available knowledges and incorporating them into one singular structure is where AI will come in, is where you will identify vulnerable groups and help them live a better life by tailoring a particular approach to life, which will help them stay healthy.
So
Does it make sense?
yeah, it makes sense. It feels like a saga listening. I really enjoyed the words word by word from you. But coming towards the fag end of our chat, I didn't want to stop. But as a liver transplant surgeon, any memory for of a patient which you would like to share with us? Weird, happy, sad, whatever you have to contemptuate on that.
So there are too many of them. Unfortunately, what happens is that the horrors stay in memory longer than the smiles. The smiles you forget, and the horrors are etched in your memory. And I don't want to tarnish your beautiful episode by telling you some horror stories. Yes. Having said that, like I said, when we started liver transplant in Apollo Chennai, we were the first program in southern India, and we had the opportunity to initiate programs in, the like ma'am said, in Pune. We initiated in Bangalore, in Hyderabad, and we came across numerous patients who initially had no hope. Were told that there was no hope. We came like God sent news to them, and when they underwent successful transplants, the gratitude that we received from them has always overwhelmed me and kept me going in spite of whatever adversaries. Um, we have had adventurous times when we have had to stop moving aircrafts on runways to be able to, transport organs in time. We have traveled in Air Force rescue choppers in order to get organs back in time. And we have had near death accidents where, our ambulances have fallen off the dividers, and, all these en route transporting organs, doing transplants. We have transplanted in my time, that was the smallest, youngest, the smallest and youngest patient, about 2.5 months old, 3 months old kid that came from Oman. There was one 3 years old girl who was in acute liver failure. And in Oman, I had done some lectures, and there was no transplant program there. This this girl was a daughter of an extremely wealthy diamond merchant. I'm not allowed to name them, but one of the richest people in the Middle East. And the daughter was dying. They chartered an aircraft and brought her to Chennai, and we used her maternal uncle's liver to transplant her. And he sent me last year a photo of her graduating from high school. She became 15 years old, and such gratifying moments we have had. Life has been very exciting and very fulfilling because of this vocation. Everybody does their life's vocation, and we do it just as a vocation. We do not assume any godly powers or roles. We know exactly what we do, and we know exactly how nature helps them, heal and cure. But the gratitude and fulfilled the sense of fulfillment that I have received because of liver transplant um, has uh, has made me feel a very blessed person.
Thank you so much. So nice. I mean, that's like saving such a small girl and seeing a picture of 15 years. I think
Yeah.
it's a moment rather, I would say.
Yes.
So, a golden piece of advice. Why I say golden? Because every word coming from you is a lesson from people who really need to know that liver is something which needs to be cared for before it's too late.
Yeah. So, liver is your powerhouse. Liver is your homeostasis. Liver gives you the spirit. They say jigar, as they say in Bollywood. Jigar, people think it's about the heart. Actually, jigar is liver. So we have a foundation which we now call Love Your Liver Foundation, but initially we were going to name it Jane Jigar Foundation because it is about life to the liver. So what I want to say behind all this is that the poets were not wrong when they said Jane Jigar. What you love about a person is not the heart. What you love about the person is the liver, because it is the liver who makes the temper, the temperament, the spirit, the vigor, the zeal that you like in a person is brought out by the liver, not from the heart. And so the way to live happily is to take care of your liver. So we say this, that you love your liver and live a happy life.
Thank you so much, Dr. Anand. So I think we had a very good, crisp take-home messages from you. As a woman, and to the women who are listening this, and all the spouses who are listening for their better halves, sisters and mothers, do take care of your liver of yourself. Even I think males are not apart. They should also take
Mm.
because I think ultrasound scan, a good health checkup by the age of 35 with early defining that, good
Mm.
lifestyle measures, as sir already said, 80% is diet, 20% is exercise. So you manage your diet tactfully. Don't starve yourself unnecessarily, because timing, perfect eating, and eating the right thing goes in the right way to protect you and liver. As Dr. Anand said, Bollywood has got a favorite term, jigar mein dam chahiye kuch bhi karne ke liye. So I think having a happy liver is the goal for everybody. So maintain your liver. Don't fall prey to any of the things which are easily available, cheap availability. Always see an expert before you gobble of anything. Before you have the knowledge of anything, taking it just for the faith of being, because the bhed chal that everybody's taking that and getting benefited is not the right thing to do. And as I can see Dr. Anand's face glowing with whatever he has given to his patients, I think transplant has become an easier job. Though difficult for you, I know it is hours of surgery,
Mhm.
needs a lot of dedication and control over so many things in your body when you're operating, the passion and time consuming as well. But I think helping people to revive is one good thing you are doing. But people who are getting revived, please do share your stories to those who are not still taking care of themselves as it is rightly required. So totally overwhelmed, Dr. Anand, with your presence. Dr. Sunita
Thank
ma'am
you.
giving us this opportunity and taking out time from your busy schedule, and looking forward to see you sometime more in our
Sure.
podcast with, I think the pancreas has been left untouched today. So we'll meet
Next
together
time.
again next time. Thank you
Thank
so
you.
much. Shabbat
Very
Khair
nice.
night for
Thank you.
this 200th episode. I feel very fulfilling because my liver is safe after the discussion today. Thank you so much, Dr. Anandji.
Thank you. Thank you once again. Pleasure.
Thank you, support team, for being with us. So
Thank
today, ending Gyan Pravah with a happy jigar. Bye for now. Thank you.
Thanks. Thank you.
Support team.